First of all, let me thank you all for such a very important initiative. And I'm being tested today because I know firsthand that diabetes is a very serious disease. I know several people who are living with diabetes, and I'm being tested because I want to make sure that all the residents that I represent on the council, as well as residents across the District of Columbia, know just how serious diabetes is. We want to make sure that they're aware that diabetes is referred to as a silent killer because often the symptoms go unnoticed, which is why it's important to make sure that we promote education and initiatives like Test a Million.
Why are you encouraging folks in Ward 5 specifically to get tested? I mean, there are issues of elderly people,
Absolutely.
issues of race. Could you elaborate a little bit?
Sure. There's a bit of an irony. I represent Ward 5. Ward 5 has more hospitals than any other ward in the District of Columbia, yet we're third with the highest rates of diabetes, obesity, heart disease. And so it's important to make sure as a leader in Ward 5 that I demonstrate how easy, painless, and quick it is to be tested and to know whether or not you have let me start over. How easy, how painless, and how quick, right? As a leader of Ward 5, it's important to demonstrate for my constituents and all the residents in the ward just how easy, painless, and quick it is to be tested. Diabetes is very insidious, and although we have more hospitals in Ward 5 than any other ward, we have some of the highest rates of diabetes, obesity, heart disease, and so it's important to make sure that residents are aware of these facts.
Thank you. You're a public official, and fiscal constraints and having to do more with less budgets are always important. How much does diabetes cost us?
Well, obviously, we're talking about the budget of the city and how much money we have and how we allocate those funds. The health costs associated with diseases like diabetes are costing the city millions. Across the country, it's costing taxpayers billions. And so it's important to promote awareness so that people know that, first of all, this is preventable with healthy lifestyles, diet, exercise. This is something that we can definitely try to make sure that people are taking the steps necessary to prevent this from happening to them.
Okay, diabetes disproportionately affects African Americans and other people of color, Latinos and Asians, African Americans. Why should African Americans, Latinos, and Asians, people of color, be concerned about diabetes and participate in this testing program?
It's so important for African Americans to participate in this program because we're dying from this disease, and we are being diagnosed with diabetes at a greater rate than other races in the country. And so we need to know what can cause it. We need to know what we can do to prevent it. We obviously need to know that getting tested is the first step to making sure that we're aware of these things. And we have to focus resources on the front end to combat diabetes and other acute diseases that are really affecting us at greater numbers than other races across the country.
In parting, is there a feel of what you think organizations, nonprofits, or the community at large might do to reduce the amount of diabetes and reduce the rising epidemic?
Absolutely. Embrace initiatives like Test a Million to make sure that there's supports, there's funding, there's resources associated with public awareness campaigns to make sure that we're educating our residents about diabetes so that they know how easy it is to make sure that they get tested, so that we're promoting healthy living, healthy eating, diet, exercise. We're putting money and to make sure that they can go to recreation centers to exercise, they can swim, to make sure that in our classrooms our kids are eating healthy foods. There are a number of things that we can do to prevent it. I'm a huge proponent of those types of initiatives because I think if we make the investment early and often and on the front end, then the extreme cost, the millions and billions of dollars that we're paying in the city and across the country, perhaps we can prevent or at least cut down on.
Ad lib, we're gonna take this thing on out. You're gonna look at the camera this time.
Okay.
The 30 seconds.
Can he just say one sentence that says the
Sure.
test is, with you all is free?
Okay.
Oh, definitely.
Okay.
As the Testimillion program, which includes testing for diabetes and hypertension, are free to the public.
Okay.
Just that sentence.
Yes.
Sure.
Yes, thank you.
It's for testing for diabetes and hypertension?
Yeah, because the two diseases are
Okay.
connected, so.
Okay. It's important for everybody to know. Ward 5 residents, all 630 plus thousand residents of the District of Columbia, that the Testimillion test is free. The test for diabetes, the test for hypertension are both free, and we want individuals to make sure that they get tested.
Thank you.
It's important because it all affects how you live, how you continue to live. Because we have kids, I'm from Prince George's County, and we have kids that are juvenile diabetics. And the testing really starts. We have elementary schools, we have middle schools, and if we can get people started really early as far as taking care of themselves and monitoring themselves, I think that we can get a handle on diabetes as well as control, especially for the type 1s. The type 2s, like you said before, it was definitely related to diet and exercise, and if we're not proactive in our own health, no one is going to be more proactive than yourself. So education is just the key to everything. Any disease process, education, education, education.
Give us your name and your title.
My name is Jacqueline Dawkins. I am a school nurse with Prince George's County Schools, and we have a diabetic educator. We have the nurses in the school. I mean, we have kids now are just not going to a specific school. They're being integrated in all the schools. So all the different conditions, health conditions we have to deal with on a day-to-day basis, as well as a lot of diabetic kids. And we see them, and once you educate them, and you can see the transition from elementary school to middle school, then you see them in high school, and they're adults, because I also work in a hospital. And then you see kids coming in, and you see, didn't I see you last week, and didn't I see? That's where the education came in. Now you see the ones that are controlled, you'll see them less often, and you'll see that they eat better, they do better. I mean, economics is a big factor in what they eat, but you'll see they make better choices.
I think it's very important for young people to be proactive and take steps to improve their health and to be engaged in a campaign like Testimillion. I know that in my family, I have a history of diabetes, hypertension, and obesity. So I've made strides to eat healthy, to exercise, but I've never taken a diabetes test. And so the fact that it's free, it's quick, it's painless, I'm really looking forward to it, although I hope it doesn't hurt. I'm making sure that I take those steps now at a young age.
I'm participating in the Testimillion for those testing for diabetes because it's personal to me.
Why?
Because I want to make sure that our people are aware of the importance of testing for diabetes, because diabetes has become the silent killer.
African Americans and diabetes, and your congregation and the public at large. What are your thoughts about Testimillion and how that might help?
Well, some of our people refuse to go to a doctor, so this will be an opportunity for people to come and get tested free of charge and to find the results and to maybe follow up with their physician.
Churches and their congregations, what might churches, especially the African American church, might do to prevent obesity, which is connected to diabetes? What kinds of things might we hear from the pulpit?
Exercise, more diet, and especially regular checkups.
Will shock it, so I just leave it and then I'll prime it up and done. blood did you eat?
Actually, I eat probably about 9.
That's a good blood sugar,
Oh, okay.
109.
Okay.
That's actually perfect because
It's like eating apple.